Before I start, I want to say thank you on behalf of all the people in the Netherlands, because in the first COVID wave, Germany was a real friend. We had a lot of patients in the intensive care units. We're a dense populated country, so we had an enormous rise in the hospitals with COVID patients, and the emergency capacity was not enough, and about 50 of the patients were transported to Germany. And we will never forget in Holland, because at the most severe part of the first wave, you really helped us out very well. So I want to thank, on behalf of all the people in Holland, the German colleagues who have been terrific for us. So then I'll start with next slide, please. The way we organize our acute and emergency care, the way we organize it, the way that patients go through the route, and I'll tell some things that are slightly different from Germany, I think. Some facts and figures. I have an animation film, which I have translated to German for the direction we're heading in. I'll tell short about a pilot of care coordination in IJsland, that's more east of the IJsselmeer, and the way our Ministry of Health is thinking the direction we should be going to manage the problems we have. Can I have the first, please? Well, for Holland, who don't know, we got 70.2 million inhabitants. The money which goes to cure and care is 82.3 billion euros. And what's important that we have the general practitioners in Holland who are really the gatekeepers of the system. So that's different, maybe a little different from Germany. Everything starts with the general practitioner. When you're ill, and when there's not a life-threatening disease, you go to the general practitioner in the daytime, and in out-of-office hours, they have a quite well-organized system where they see the patients first. That's the general practitioner centers. And then we have the EMS, the ambulance services, and what's I think a bit different from Germany is that all the personnel, we've got a nurse-based system, all the personnel are trained in the same way. They are very highly skilled nurses after being in hospital for some years on ER or intensive care. They get a education for about 2 years before they can be on the ambulance. And in whole of Holland, they are all the same trained, and they all use the same protocol. And the last part is about the hospitals. I think it's different. We have per million inhabitants, we have about 4.4 hospitals, while you in Germany have per million inhabitants, you have 19 hospitals. So you have much more hospital facilities than we have in Holland. So that's different. Next slide, please. I talk from the perspective of the ROAS. The ROAS is the regional organization where we have organized acute and emergency care. So now in times of the second COVID wave, which is really getting severe in Holland, we have a lot of infections, especially around the bigger cities like Amsterdam and Rotterdam and The Hague. So it's really rapidly increasing. We are organized in parts of the country, and the ROAS region I'm talking about is 3.1 million people with 20 hospitals, 6 ambulance services, and 11 general practitioner centers. Next, please. And what's the way the patient go through the system? As I told before, we have 12,500 general practitioners. Everyone starts with the general practitioner in Holland. So the general practitioner sees the patient, unless it's really life-threatening, then they will phone 112, and then the general practitioner will decide which way to go through the system. And the general practitioner centers are in out-of-office hours. It's a really dense network of general practitioner centers and works really well. And then the third is the people who think they have a real health issue, they call 112, and then they get the ambulance. And then we have the people who don't call 112, don't go to the general practitioner, but go to the hospital themselves. And that is, especially in the bigger cities, a lot of people have the hospital near, and then they just go to the ER and don't go through 112 or the general practitioner. Next, please. And what are some facts and figures? The Roos region, the 3.1 million people, how many patient contacts do they have? The general practitioner center, this out of office hours in 2019, 820,000 patient contacts. Far more than on the ER. So the ER has, in the same region, has 400,000 patient contacts, and the ambulance is at work in 280,000 times. And a problem which we really should solve is we have arranged an organization where we expect people to know in which case to go to the general practitioner or the general practitioner center, and in another case to call 112, but a lot of people don't know. We have arranged it that if someone has a kidney stone, then he should not phone 112, but go to the general practitioner. But does everyone know? I think a lot of people don't know which number to dial when they have a problem, and when they have to wait long, then they go to the other number. So we have to comprehend the system, get it closer together. Otherwise, you have a sub-optimization. And I have the next, please. And then we have a short film because it helps us as the health institutions like the EMS, the hospitals, and the general practitioners to come in, what we say, in one film. And I had an animation and I have it translated to German, so it's easy for you to follow. Can we please start from Berlin, my animation film about care coordination centers?
Die Notfallversorgung in den Niederlanden steht unter Stress. Bis 2040 wird die niederländische Bevölkerung um 1,3 Millionen Menschen wachsen. Die Zahl der älteren Menschen wird sich bis dahin verdoppeln. Bereits heute haben Hausärztinnen und Ärzte wenig Zeit für ihre Patientinnen und Patienten. Die Wartezeiten beim Haus- oder Notarzt sind lang. Und die Rettungsdienste haben in vielen Regionen längere Reaktionszeiten. Inzwischen spezialisieren sich die Krankenhäuser immer stärker, konzentrieren sich Fachärztinnen und Ärzte an bestimmten Orten und wird die Behandlungszeit in Krankenhäusern kürzer. Dadurch steigt die Arbeitsbelastung bei ambulanten und häuslichen Pflegediensten, während die personelle Kapazität im gesamten Sektor niedrig ist und der Arbeitsmarkt knapp ist. Für Patientinnen und Patienten ist die Situation immer weniger transparent. Sie fahren von Praxis zu Praxis oder werden über größere Distanzen transportiert. Zugleich wird der Versorgungsbedarf mit dem Alter immer komplexer und dringlicher, auch weil ältere Menschen immer länger selbstständig zu Hause leben. Wann also sollen Patientinnen und Patienten bei wem anrufen? Und wegen was? Wie schön wäre es doch für Patientinnen bzw. Patienten und Gesundheitsdienstleister gleichermaßen, wenn alle Notfälle an einem zentralen Ort zusammenkämen. Je Region an einem einzigen Koordinationszentrum, das dafür sorgt, dass Patientinnen und Patienten schnellstmöglich richtig behandelt werden. Von dem richtigen Gesundheitsdienstleister zum richtigen Zeitpunkt und am richtigen Ort. An einer zentralen Stelle, die Gesundheitsdienstleistern aktuelle Patienteninformationen liefert und Kapazität zur Verfügung stellt, um höhere Qualität bieten zu können. Eine solche regionale Koordination im Gesundheitswesen ist möglich, wenn Notfallversorger wie psychische Gesundheitsdienste, Hausärzte, Notfallpraxen, Rettungsdienste, Krankenhäuser, häusliche Pflegedienste und Hebammen gemeinsam 5 wichtige Schritte organisieren. Erstens: transparenter Zugang. Es wird eine zentrale App für die Notfallversorgung eingerichtet. Daneben gilt weiterhin die bekannte 112 für akut lebensbedrohliche Situationen. Zweitens: Triage-Protokoll. Die kooperierenden Anbieter in der Notfallversorgung entwickeln ein gemeinsames Triage-Protokoll, damit alle Gesundheitsdienstleister in der gleichen Weise beurteilen und die Triage durchführen. Drittens, passende Versorgung. Expertinnen und Experten, die die gesamte Kette kennen, legen fest, welche gesundheitliche Versorgung die passende ist. Das kann der direkte Kontakt zwischen Gesundheitsdienstleister und Patient/Patientin sein, Beratung zur Selbstversorgung oder die Verweisung zu planbaren Gesundheitsleistungen. Viertens, Steuerung der Nachsorge. Das Koordinationszentrum steuert die Versorgung nach dem Erstkontakt so lange, bis für eine gute Nachsorge gesorgt ist. Dann übernehmen andere Gesundheitsdienstleister oder die Patientinnen und Patienten selbst. Fünftens, Selbstmanagement. Das Koordinationszentrum unterstützt das Selbstmanagement der Patientinnen und Patienten mit Informationen, Beratung und Technik, sodass Gesundheitsdienstleister nur dann tätig werden müssen, wenn ihre Hilfe wirklich benötigt wird. Wesentlich bei allen diesen Schritten ist, dass das Koordinationszentrum an einem zentralen Punkt Zugang zu allen relevanten aktuellen Informationen über die Versorgung in der Kette und über die Patientinnen und Patienten hat. Wenn die Notfalldienstleister gemeinsam die Steuerung übernehmen, können im Jahr 2025 überall in den Niederlanden regionale Koordinationszentren für den Gesundheitsbereich wirksam funktionieren. Der Gesetzgeber hat den Weg freigemacht für die Einrichtung von Koordinationszentren im Gesundheitswesen. Und als mobiles Bindeglied zwischen allen Parteien prüft Ambulance Zorg Nederland als Vereinigung der Rettungsdienste in den Niederlanden, inwieweit auch andere Notfalldienstleister Möglichkeiten sehen, diese Zukunftsvision in jeder niederländischen Region zu realisieren. Regionale Koordination im Gesundheitswesen. Gemeinsam eins werden.
So I can continue. The film we made is to really have the opening of discussion with all the health institutions to get together, and we made it a year and a half ago. From that moment, we have been trying to do a few pilots, and I'll tell you a little bit about one pilot. It is in a smaller region of about 400,000 people, and then it's easier to get together. So the points you have been seeing in the film is the one access number. We have established that in Zwolle, in the region Ashland, to get the triage system together with all the health institutions who are united in the dispatch center, to provide the appropriate care, because they work together in the moment the phone comes in. The following the patient through the system is one of the key issues, and self-management is established also in this pilot. We have a short time, but it's good not only to have a film in which direction you want to go, but you also have to start with pilots to see what it brings and what are problems. But it's really promising. We have some more pilots in Holland, but that's the direction we're aiming in. And to finish, it's important that our Ministry of Health really thinks in the same direction. So they have a 6-point plan. They have made it this summer. It's going around for deepening discussion in going in one direction with all the health institutions. And these are the 6 points that they say, well, in emergency care, we see a lot of things which could be prevented. We should do more about prevention, point 1. Point 2 is really important for us, you have 112 for the really life-threatening things, and all other things make the care coordination center work. So the ministry follows the line I've just presented. The third is that we should prepare to get more out of hospital to the patients, like in the elderly people, the geriatric care should come from hospital to the people at home. 4 is to work towards an integration of the general practitioner center, the acute mental health center, and the ER. We have some very nice examples where there's one front door, and after that the patient goes in the direction which he can be helped best. The fifth is what's also seen in the film is to concentrate really specialized treatments in fewer hospitals in Holland. And the sixth, and I think that's really, really important, we should explain to the general public in which way we arrange the system. But it makes it much more easy if there's one center of coordination than people who don't know what to do and they're phoning this number and that number. So it's all going towards an integration and a good explanation and good communication to the general public what we have been, what we're working at. That is my presentation about the Dutch situation and the way we're heading. And I'm really happy that also the Ministry of Health is supporting the route we are following now from the perspective of the health organizations. Thank you very much.